OET speaking. Sample test 1. Claustrophobic patient. Radiography. You see a 38-year-old patient in the final stage of an investigation for chronic back pain. He or she needs to have an MRI, magnetic resonance imaging, scan, but is worried because he or she often feels claustrophobic. He or she feels uncomfortable and anxious in enclosed spaces, but does not have a formal diagnosis. Confirm reason for visit. MRI, magnetic resonance imaging scan. Find out if patient knows why he or she is having MRI. Explore patient's knowledge or experience of MRI scans. Describe MRI scan procedure. For example, cannula in arm, lying still on table, moving through scanner, etc. Explain need for injection of contrast. For example, clearer, better quality images, etc. Find out relevant patient details, any allergies, history of kidney problems, etc. Outline timescale for MRI. For example, 30 to 60 minutes, etc. Advise patient on ways to reduce sound. For example, provision of earplugs for noise, non-magnetic headphones to listen to music, etc. Reassure patient about MRI. For example, scanner, wide, open at both ends, calming strategies, covering eyes, breathing and meditating, provision of blanket, etc. Explain procedure if sedation required or unable to remain still in machine. For example, rebooking new appointment, etc. Establish patient's consent to begin scan procedure. You are a 38-year-old patient in the final stage of an investigation for chronic back pain. You need to have an MRI, magnetic resonance imaging scan, but you are worried because you often feel claustrophobic. You feel uncomfortable and anxious in enclosed spaces, but you do not have a formal diagnosis. When asked, say your doctor told you that you need to have the MRI to investigate your chronic back pain further. When asked, say you've never had an MRI before, so you're not sure what to expect. When asked, say you don't have any allergies or kidney problems, but you'd like to know how long the scan will take because you've heard the scanning machine can be very noisy. Say it's good to know that there are ways to reduce the noise, but you're a little claustrophobic, so you're still very worried about this scan. Say you feel a bit better now, you're ready to begin. Good morning, my name is Lou. I'm the radiographer here at the hospital. Can I get your name and your date of birth, please? Certainly, Lou. My name is David, and my date of birth is the 1st of April, 1988. Nice to meet you, David. What can I do for you today? The doctor told me I need to have an MRI to investigate my chronic back pain further. I see, David, you're here for an MRI. Great. Do you know why you're having the MRI? Yes, the doctor told me it's to investigate my chronic back pain further. Perfect. Let me ask you a few questions before we start, please. Have you ever had an MRI scan before? No, I've never had an MRI before, and I'm not sure what to expect. Well, David, try not to worry. MRI scans are very safe, and we do them here in the hospital every day without any problems whatsoever. Let me explain the procedure. Is that okay? Yes, of course, that's fine. So, you will have a cannula inserted into your arm. This is a small tube that allows us to administer medication or fluids directly into your vein. You will lie still on a table while the scanner takes images. During the procedure, you'll receive an injection of contrast dye, which helps us obtain clearer and more detailed images. The contrast dye enhances the visibility of certain areas in the X-ray, allowing us to better understand the results. Do you have any questions? No, Lou, that's fine. Great. Let me ask you a few more questions. Do you have any allergies? No, luckily I don't have any allergies. Great. What about a history of kidney problems? No, my kidneys are fine. I've never had any issues with them. However, one thing that I'd like to know is how long the scan will take, because I've heard the machine can be very noisy. I see, you've heard the machine can be noisy. Well, try not to worry. There are things we can do to eliminate the noise. The scan will take 30 to 60 minutes, and you can use earplugs for the noise or even non-magnetic headphones to listen to your favorite music during the procedure. How do you feel about that? I'm happy to know that there are ways to reduce the noise, but to be honest, I'm a little claustrophobic, so I'm still very worried about the scan because of this. I understand, David. It's normal to feel like this for your first scan, but rest assured, I'll be with you the whole time just outside the scanner. The scanner is quite wide, it's open at both ends, and I can explain some calming strategies which may help you now if you like. Would you like me to explain them? Yes, please, I would. If you're feeling anxious, you can try covering your eyes, taking deep breaths, and focusing on relaxing or meditating by focusing on your inhalations and exhalations. We'll also provide you with a blanket to keep you comfortable and warm. The procedure will be over before you know it. If you find it difficult to stay still in the machine, we may need to reschedule and give you a sedative to help you relax. However, most people manage just fine, so try not to worry too much. We're here to make this as easy as possible for you. Everything will be fine, and I'll be here just outside the scanner the whole time if you need anything. How do you feel now, David? I feel a bit better now, Lou. Thanks for explaining everything to me. No problem at all, David. That's what I'm here for. Would you like to start the procedure now? Yes, I'm ready to begin. Let's go. Let's get started. Pause the video and practice. Please like this video to help me build this channel for you. Thank you for watching. Good luck with your studies. Stay motivated. You can do it.